Now finally, the last form of a simple shunt lesion we would like to discuss is the patent ductus arteriosus. Prevalence in adults is rather low, about 2% in the adult population. We have, again, as a consequence of the PDA, a left to right shunt with LV volume overload, but again, the pulmonary circulation has not only to face volume overload but also pressure overload, and the patients again will develop more or less pulmonary artery pressure elevation, and if we have a large PDA, these patients will also develop Eisenmenger syndrome. Now, since the shunt is here at the level of the descending aorta, these patients have then a differential cyanosis and will have cyanosis only of the lower part of their body and of their legs. The associated lesions are coarctation and ventricular septal defect as the most common ones. PDA after transcatheter closure is one population we look at in an adult population. Actually, most of the patients with PDAs will be closed as soon as they become adults, but we will still see a small population of patients with a small PDA not closed during childhood. These patients may either have no relevant shunt, and the question is whether they will require closure by consensus. As soon as we have a PDA with a murmur, we will probably do this today. Then we have the rare patients with significant shunt who have either developed due to left ventricular volume overload an aspect of similar to a ventricular to a cardiomyopathy, and they may be mistaken as a dilated cardiomyopathy. And on the other hand, we may see patients who have developed pulmonary arterial hypertension but have not developed yet Eisenmenger, and these patients present predominantly with the signs of right ventricular pressure overload. Now, at the end of the spectrum, we see the rare patient with a PDA who has developed Eisenmenger syndrome.